Since we're in the butterfly program, the butterfly is our new symbol for Kayla, which I'm sure it is for a lot of butterfly families. My kids love to draw butterflies, and we buy different butterfly shirts and butterfly trinkets and everything. Butterfly represents Kayla to us.
20 weeks in utero when we found out that Megan has a condition called osteogenesis imperfecta, which means that she breaks easily. She was reaching for a toy the other day and it broke her left arm. And Butterfly came into our lives when Megan was about 9 months old, 8 or 9 months old. It is so unique in what it does and the services that it offers and the peace that it can provide to families.
I like butterflies a lot. I like they make me think of the program, but they also make me think of freedom.
We felt that there were a lot of children who had life-limiting illnesses who could really benefit from having palliative care. Certainly they were getting the medical support, but they weren't getting the emotional support that they needed, so the psychosocial, spiritual support. We are the only program in the city that offers this type of palliative care, and now we have a great team that consists of nurses, social workers, chaplain support, bereavement support, music and art therapy, and volunteers. And so it's really grown tremendously over the years, which is wonderful. So I think over the next 5 years, I see the program growing in size. Obviously, with growth in size of the patient numbers, it would be growth of personnel as well. So I think the next 5 years will bring a lot to the program.
Through the Butterfly program, gave us a professional photographer who was able to take our pictures, and this is one of the girls did together with Kayla. Because even though she had a lot of different medical conditions, she couldn't communicate, she was extremely happy and she loved people. After her last brain surgery, her conditions came back, and they realized that that there's nothing else that they can do. There was no more surgery that they can do, and that her brain was going to slowly deteriorate. It's very difficult to realize that I'm never going to be able to take another picture again.
3 of the younger girls have the Friedreich's ataxia, all 3 of them in the wheelchair. And shortly thereafter, my former wife, the girls' mothers, passed away from breast cancer. The girls were diagnosed many years ago, and we were given an approximate time that they're going to be around, and it's something that I never thought about and wanted to consider, but as their conditions worsen, it's something that I have to deal with. That it's gonna tear me up if I don't start dealing with it in the meantime.
It says, she knew that she was formed by God's hands, dreamed up in His heart, and placed in this world for a purpose.
This is different, and this is why, but this is our life, and we're going to do it.
The support that the group will give tonight for Butterfly really goes directly to the children. And I think it does make a difference in their lives. It makes the horrible not quite so horrible. And we do talk about the end and how that will be, but what we would really like is to make the time that the children have left to be as pain-free and as pleasant as we possibly can, and help them to set priorities and goals that make their last days, years, months, weeks, whatever we have, as pleasant and as true to their desires as we possibly can.
To date, we've probably served over 550 patients and families. Our social workers just do a beautiful job at finding resources in the community for these patients and families, and they just feel much, much more supported.
They have been incredible. The services that they offer, and not just for Megan and navigating children's and that whole world of its own, but also for Pete and helping him as a sibling through this. They have helped us open these lines of communication, not only with the hospital, but with each other and with a 5-year-old who, you know, needs to understand what's going on with his sister and why it's okay to love her still.
Butterfly program mainly works to help me manage my pain through medicine and through other ways, and they help me just deal with being sick and learning how to live like that.
So Caleb passed away on January 14th, 2014. And it was 10 days before her 12th birthday. We would not be able to take care of Kayla the last year of her life if it wasn't for the butterfly program. And just knowing that her pain was managed the entire time and that she still always had a smile on her face.
We do hope that you will join us in supporting these children. Their journey is so hard and so arduous, and all of your help is such a support to them in this very difficult time, and for the parents who are asked to do the hardest thing that a parent can ever be asked to do. Thank you again for all your support.
Thank you, Butterfly Program, for helping my sister with the last year of her life.
Thank you for being here tonight.
Thank you so much for all your support and your generosity.
Thank you. Thank you.
Thank you all very, very much.